Welcome today, and very grateful to be able to provide the opportunity to welcome on behalf of our Indigenous communities within locally and also far and wide throughout Turtle Island. So I'm also grateful to acknowledge this day of Pink Shirt Day and how it's supporting good energy and kindness with one another. This evening's topic is Métis and MHSU in BC. I would like to introduce Tanya Deveron, Dr. Kate Elliott, and Kelsey Weber. Thank you for joining us today. Before we have our special speakers introduce themselves and begin the webinar, here are just some housekeeping to take care of. We ask of you to save your questions at the end of the presentation, and Carrie will be able to direct to the presenters when the presentation is done. And also just wanted to share that the webinar will be recorded and will be shared for all of those who are in attendance and available to review at a later date for those who are unable to attend. Thank you everybody for being here.
Great. Thank you so much, Gracie. It's a pleasure to present again from Métis Nation BC, and I'm pleased to have our doctor and our Minister of Mental Health and Addictions, Dr. Kate Elliott, join us, as well as our Provincial Harm Reduction Manager, Kelsey Weber, join us today with the presentation. Just want to acknowledge that I am calling in from the shared territories of the Squamish, Tsleil-Waututh, and Musqueam nations. And I originally come from, or normally would be calling in from Silks territory, home of the Vernon District Métis Association. My name is Tanya Deveron, and I'm the Executive Director at Métis Nation BC for Health, Mental Health, Harm Reductions, Elders, and Veterans portfolios. So thanks, Gracie, for starting us off in a good way. Acknowledging too, I think today that 2,511 lives have been lost to the toxic drug overdose crisis in British Columbia in 2023. So I'll pass it on to Dr. Kate Elliott.
Tansy, everyone. I'm calling in from the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh people. I am with MNBC. I'm a provincially elected official and hold the ministries of women and gender equity, as well as mental health and harm reduction. I joke, my side hustle is I'm a family physician with a bit of specialty in addictions, working out of Kool-Aid in Victoria, as well as the Victoria Native Friendship Center. I provide outreach to Patchadap First Nation, as well as provide mobile outreach to the Aboriginal Coalition to End Homelessness. In Victoria, really looking forward to this opportunity and dialogue, and hopefully please ask lots of questions. We like to have a dialogue and answer any questions and just brainstorm of how we can help create meaningful changes in the practice and help navigate.
Thank you, Dr. Kate. Tanshem, Kelsey Weber, Dishinit Cinemak Nikiwan, Patlichne Gini Twakin, Kishite Mayan, Unlimited Shipwian. Hello, everyone. My name is Kelsey Weber. I just got married recently, and I'm still adjusting to that change. I'm very grateful to be calling in from the traditional unceded territory here on what's colonially known as Nanaimo. I'm the traditional territory of the Snuneymuxw First Nations. I reside as an uninvited guest with my husband and my family. Though I always like to acknowledge that I was born and raised on the traditional and unceded territory of the Lheidli First Nations and what's colonially known as Prince George up in north central British Columbia. I'm a very proud Métis woman and youth and a registered citizen with MNBC. And I'm very honored and grateful and privileged to be able to serve MNBC in my nation as the Provincial Harm Reduction Manager. I will be providing the presentation today, but just so everyone knows, I got pulled into this at like 3 o'clock this afternoon. So this is not what I thought I was going to be doing this evening. So please bear with me as I am bound to stumble over a few things here and there, but I will be doing my best. And yeah. And I'm just wondering, so am I just sharing my screen right from the start here? Okay, fabulous. So bear with me. I feel like I never use Zoom anymore. So this will be interesting. There we go. I'm hoping we're seeing awesome, getting thumbs up. Okay, so I am here this afternoon to share about the amazing and fabulous work that Métis Nation British Columbia's Ministry of Mental Health and Harm Reduction is doing. I think before we dive into all of the fabulous programs and things that we have going on, it's really important that we situate ourselves and provide a little bit of background information as to who MNBC is, who we represent, all of that good stuff. So Métis Nation British Columbia represents the Section 35 rights of over 24,000 Métis citizens who are registered with MNBC, and we advocate for over 98,000 self-identified Métis in British Columbia. MNBC further represents 40 Métis chartered communities in British Columbia. We just added our 40th community recently. And we are recognized by the Métis National Council, Provincial Government of British Columbia, and the Federal Government of Canada as the governing nation for Métis in BC. These are some of the 40, I don't think we've added our 40th community yet, but this is where our communities are located across the province. I'm a very proud member of Community 27 up there in North Central BC. But I think it's important, and I believe I missed this in my land acknowledgement because I'm a little bit nervous. But I always like to take a moment to recognize that when I'm giving my land acknowledgement, recognizing the land in which I reside on as being the chosen home to the respective Métis charter communities. So for where I am here in Nanaimo, I also reside on the chosen home of the Mid-Island Métis Association. All of the work that we do within our ministry, we work very hard to ensure that it's grounded in Métis specific approaches. And this is really important because the Métis Nation is one of 3 distinct Aboriginal peoples in Canada recognized in Section 35. And we have unique collective cultural practices, kinship ties, and history. In 2002, the Métis National Council adopted the following national definition. Métis means a person who self-identifies as Métis, is distinct from other Aboriginal peoples, is of historic Métis Nation ancestry, and who is accepted by the Métis Nation. So when I was, and I'm very grateful that my mom applied for my citizenship when I was I think 3, but the process in doing so is we first have to acknowledge that we are Métis. We have to self-identify as Métis, and then we have to trace our ancestry back all the way to the homeland. So in my family's case, it's the Red River settlement. We have to apply to our chartered community or a Métis community and be accepted. And we also have to be distinct from other Aboriginal people. So I do have some friends and colleagues who are both First Nations and Métis, and they have to make a decision, unfortunately, between their status and their Métis citizenship. So you have to be distinct, and you have to kind of meet all of those requirements to hold citizenship. It's really important that we utilize distinctions-based language, such as using Métis, First Nations, and Inuit because this supports cultural visibility for these nations. Further, utilizing a Métis-specific approach to Métis mental health and wellness promotes healing, self-acceptance, and pride for Métis individuals. It's really important to ensure that our community members, our Métis community members, can see themselves reflected in the care they're accessing, and know that when they're accessing mental health and harm reduction services, their identity is going to be acknowledged and respected and not questioned. So just ensuring that we're using distinctions-based language can be really beneficial and impactful for individuals. A really great resource that I think our entire ministry kind of roots a lot of what we do in is a resource called Kwitcha Hatoyak. We take care of each other, a Métis perspective on cultural wellness. I would strongly encourage if anything that we speak about today speaks to you, to reach out and we can see if we can connect you with a copy of this book. My husband is a physician, and I make him take it to all of the practices he locums at and just leave it in the lunchrooms because it's a really fabulous resource. But a little blurb that's been pulled out that I think really sets the tone for all of the work that I'm about to share is: understanding who the Métis are helps us create a safer and more welcoming community for all people. When the general public understands who the Métis are more likely to be included, acknowledged, and valued. They're also more likely to experience programs and services that address their unique needs as Métis people, and this will contribute to a feeling of cultural wellness. Okay, so the work that we all do is rooted in mental health, wellness, and substance use, or surrounds mental health, wellness, and substance use. And it's important to acknowledge that the historical and ongoing legacy of colonization has led to the mental health concerns that disproportionately impact the Métis community. Métis people face social inequities that both directly and indirectly impact the mental health of individuals and our communities. Unfortunately, due to the historical and often ongoing erasure of Métis, there can often exist a lack of data specific to Métis populations. However, the data that is available is stark, and I'm just going to share a few of those numbers that we've pulled through various reports that have been done. So in 2019, Stats Canada reported that the suicide rate among self-identifying Métis is approximately twice as high as the rate among non-Indigenous people. That is a big difference. Another one is the McCreary Centre reported that in BC in 2008, over a quarter, so 27% of Métis girls aged 12 to 19 had deliberately self-harmed. In 2018, this increased for Métis girls to 42%. This report also showed that Métis youth were less likely than non-Métis youth to rate their mental health positively. Finally, in the Tasante de Nusa report, it was shared that in the past year, Métis youth were more likely than their non-Métis peers to have considered suicide at 24% versus 17%, and attempted suicide at 8% versus 5%. We also have some stats here. So in 2018, the McCreary Centre Society published that Métis youth in BC reported higher rates of having ever used tobacco at 33%, alcohol at 62%, cannabis at 42%, and substances other than alcohol or cannabis at 24% than the non-Métis population. The Government of Canada Health Inequities Data Tool alarmingly highlights that Métis adults report significantly higher heavy drinking and alcohol use than non-Métis adults. Of note, Métis adult females report the highest rate of heavy drinking and alcohol use of both Indigenous and non-Indigenous populations. And then finally here, based on the BC coroner's mortality rate, illicit drug overdose deaths are escalating across all regions of BC, which I know we all know. Although Métis-specific overdose information remains unavailable, or we all know that, but we don't know that we don't know the Métis-specific numbers as of yet, because there is a significant gap. And I can speak to this later when I speak about my harm reduction portfolio, but there is a very large gap in harm reduction in substance use data specific to Métis individuals. And this just really highlights the need. We need to have more Métis specific data, and we need to have access to this data, and we need to also be able to collect that data in good ways, I think is really important. Okay, so testimonials from Métis community members across BC reinforce the widespread impact of substance use and addiction, emphasizing the lack of resources to support Métis individuals. As expressed during a recent MNBC town hall meeting, we were meeting with community to kind of talk about a funding opportunity. It was the 2024 SUOP funding, Substance Use and Addictions Program funding, that Health Canada had put out, and we wanted to get an understanding of what community might be looking for in terms of harm reduction services, because there aren't really any that are Métis specific as of right now, and it's sometimes hard as a staff member to know that there are so many things that would be beneficial, and not really knowing where to start or what would be best for community. So we took these questions to this town hall, and I think something that one of the community members said that sticks with all of us who were there was that they've stopped counting the lives that have been lost. They've stopped counting, you know, their friends and family and community members who've lost their lives to toxic drug poisoning. So it's important that I think it's important that, as hard as it is to constantly have that running in the back of our minds, knowing that we have communities members who are feeling like that, I think it drives a lot of the work we do, and keeps pushing us to do the best we can for our community members. So it's evident that there is a dire need within the Métis community to greater support access to culturally grounded substance use services. It's alarming, though, to see that data indicative of disproportionate mental health concerns within Métis populations. We also know that it's not uncommon to encounter mentally healthy communities rooted in the strengths of Métis culture, Métis wisdom and ways of knowing and being. Métis wisdom and ways of knowing believe that community-based approaches contribute to mental wellness. And I think through all of our programming that we've been able to roll out, we've really been able to see over this last year the impact and the benefit of grounding what we do in Métis ways of knowing and being, and grounding it in Métis community and culture and identity. And I'm excited that I get to share all of the things that we've been doing. So just some background information on the ministry itself. Our Ministry of Mental Health and Harm Reduction strives to create a whole life wraparound mental wellness, initiative centered in community wisdom and rooted in the idea of culture as medicine, utilizing a whole life approach to foster mental health and wellness for Métis individuals and communities across all stages of life, from prenatal to end of life. We seek to develop and implement mental wellness programming that is grounded in Métis culture and Métis ways of knowing and being. In understanding and recognizing intersectionality, we honor the diversity of the Métis populations across BC, a population that is inclusive of all age groups, genders, gender identities, sexual orientations, and diverse abilities. As such, our work seeks to be inclusive and representative of Métis youth, adults, elders, GBA+, diverse abilities, and the 2S LGBTQIA+ lenses. Our ministry, this is a fabulous picture from we had a mental health and wellness gathering back in the spring of last year, and this was our team then, and I think we have grown quite a bit since then. When I started back in the summer of 2022, there were 6 of us, and now I think we're at 22 or 23. So we have expanded, and the services we've been able to provide have expanded immensely since I joined on. So MNBC seeks to ensure all Métis in BC have equitable access to culturally safe mental health supports and services that are free from discrimination, promote their cultural, mental, emotional, physical, financial, environmental, social, and spiritual wellness, and are available when and where they need them. Health and wellness for Métis should be grounded in Métis identity, embedded with cultural practices and traditions, and have a strong connection to community that supports the commitment between community members. So getting into our programs, the Regional Mental Health Program is the first program, I think, that started back in the summer of 2022. And this is the program that I actually joined in on when I joined MNBC. So MNBC's Regional Mental Health Navigators support Métis individuals to navigate the mental health and substance use system, as well as connect individuals to other resources which may contribute to overall mental wellness. In 2023, the Regional Mental Health Navigation Team supported more than 800 community requests across BC. So there are 4 regional mental health navigators on our team. We have one for Region 1, which is Vancouver Island. And the way that they have been split up into the regions is respective to the health authority. So our Region 1 navigator, Kaylee, works in Region 1 and works kind of parallel to Island Health. And then we have our Region 2 navigator who works parallel to Vancouver Coastal Health and Fraser Valley. Is it Fraser Valley Health? I never remember. And then we have our region, I think it's 3, 4, 5, our Kootenay region navigator who works alongside Interior Health. And then we have our Northern region navigator who works alongside Northern Health. And our biggest goal with this program is we have citizens who reaching out for mental health support and care is very, it's a lot. It's a big job for an individual. And when you're in the thick of it, whether that's a mental health crisis or you're just learning about a new diagnosis, it's a lot to navigate on your own. And even knowing where to go or what website to look at or who to call, what appointments to make can be very overwhelming and can be a barrier in itself. So our mental health navigators are here to help individuals and community members through their journey and walk alongside them as a support and to help with that navigation piece. They also play a large role in cultural safety, education and awareness for health authorities and community partners. When I joined on as a navigator, that was one of our first kind of big tasks, was to just get the word out about who we are as Métis people and our specific distinctions-based needs that we have as a Métis community in terms of mental health and wellness and harm reduction. Our navigators are not counselors. They are not mental health practitioners. They're there to help connect people. They're that middle person, that the bridge between an individual and mental health and harm reduction services. So yeah, they are absolutely lovely and do such an amazing job doing what they do. Our next program that we have is our MIOAN Wellness Worker Program. MNBC's Ministry of Mental Health and Harm Reduction, in collaboration with MNBC's Ministry of Elders, has been working to increase access to mental wellness supports for Métis individuals that have been impacted by the harms of residential schools and day schools through hiring 2 MIOAN wellness workers. Our MIOAN wellness workers are both registered social workers, but through discussion and development of the position, we heard loud and clear from community that social worker, the title social worker, the job title social worker can in itself be triggering to some of our community members. And so in partnership with some of our knowledge keepers and the elders, the 2 fabulous team members that we have working in this program came up with this title instead. So just much more culturally grounded, and I think it is something that's respected by the community from what I've heard. So so far, our MIOAN workers have sought to provide workshops based on the needs expressed by survivors, including topics such as self-care, culture trauma, Métis residential school experiences, intergenerational healing, grief, loss, and more. They've offered virtual circles for survivors to gather, share their wisdom, and create a strong sense of community. In-person supports, including emotional support at various events and providing follow-up care to those who attended various events, and opportunities for connection to culture, and one-on-one support for Métis individuals, as well as some complex care consultation. One of our MIOAN wellness workers, Selena, just facilitated a culture, care, and connection workshop with my team actually just last week. And we talked about, self-care, boundaries, compassion fatigue, burnout, all of those amazing things. And these are things that they do with elders and with residential school survivors or those impacted by residential schools and Indian day schools. And it was absolutely fabulous. And I wish that I could spend every day in one of her culture care connection workshops, because I think the care and love that both our wellness workers put into what they do is absolutely amazing. And I think we can trust that those accessing their programs are being carried with so much love and care and concern. So that is an amazing program. Our substance use and addictions program is under my portfolio, and I could speak about this all day long. It is my pride and joy. It is my baby. We've been through a lot together. But in I want to say it was 2019, 2020, MNBC applied for the substance use and addictions program funding that Health Canada put out, and we were successful in our application. And the proposal was for a peer outreach program through a Métis lens. And in the last year, we've really been able to build this program out and make it into something I don't even think any of us were expecting it to become what it's become. But the goal of this program is to provide outreach on the downtown east side of Vancouver and in Surrey that is grounded in Métis cultural ways of knowing and being, and really views each and every individual that we support as they're our kin, they're our family, they're our loved ones. We strive to ensure that each individual we support feels encouraged to approach their care with self-determination. I think something that I'm most proud of this team for is that we have broken down harm reduction and what harm reduction looks like to our community, and we have viewed it as harm reduction is anything that we can do to limit harm in an individual's life and promote promote life, I guess, promote quality of life. We do our best to recognize that each individual knows what's going to be best for them, and it's not our job to go into this work. It's not our peer support workers' jobs to go into this work and tell people what they need, and tell people, what paths they should be going on in terms of their substance use. But we let those individuals tell us what they need, and we do whatever we can within our means to make that happen. So whether that looks like connecting individuals to substance use services in the downtown east side, or connecting people with for some individuals, we've done some like employment training and helped get them set up with work gear and things like that to get back into the workforce. With some individuals, we have looked at like cell phones so that they can stay in touch with their family. Like it really depends on what each individual is saying they need to reduce harms in their life. We have applied to more grants. Our funding, unfortunately, ends at the end of this fiscal year, so at the end of March. But we're very hopeful that we are able to get some more funding to carry this on. Our hope is to expand this into other communities across the province as well, because we recognize that Surrey and the downtown east side of Vancouver are not the only communities who are desperately needing this type of peer outreach support. And just I think just a little brag about the team and the program is we didn't really get outreach actually up and running until September of last year, September 2023. And by, I want to say January, when this presentation was made, or maybe it was even end of December, we had already interacted with 200 individuals, and over 10% of those individuals had self-identified as Métis and expressed the desire to reconnect back to their community. So that is amazing. Our team has done amazing work in such a short amount of time. Ryan, the lovely gentleman here, shared a testimonial of being a staff. So Ryan is Another important thing about this program is we strive to ensure that our peer support workers working within the program come from a place of lived and living experience. And Ryan, I could sing his praises all day long. He is absolutely fantastic and the most amazing person to be doing this work. But he shared this testimonial of what it's like to do the job he's doing. So I'll read it out. But I've stood in the same shoes as the individuals I now serve, and I understand the darkness that addiction can cast over one's life. I've seen it nearly take my own life, and I've mourned the loss of dear friends to overdoses. For me, the SUOP program represents a beacon of hope, resilience, and healing for all the Métis individuals who find themselves in the grip of the overdose epidemic. The SUOP program is a lifeline, a source of strength, and a platform for self-determination. It's about more than just recovery. It's about saving lives and offering a chance at a brighter future for Métis individuals. My mission within this program is to provide personalized one-on-one support to unhoused Métis community members and those struggling with substance use. It's about providing access to self-determination options and facilitating skill development or education, all aimed at significantly improving their overall quality of life. Through the SUOP program, I aim to be a guiding light for Métis individuals who are navigating the treacherous waters of addiction and homelessness. It's about restoring hope, fostering resilience, and ultimately saving lives. Together, we can make a meaningful impact and empower Métis community members to reclaim their lives and build a brighter future. So that gives me goosebumps every time I read it. But our program really is just, it's such a beautiful gift, which sounds so incredibly cheesy. But I think the folks that we have working in it are really there to give their hearts to this work and provide the best support they absolutely can. So yeah, so another harm reduction program that we have running out of our ministry is the Cessation and Addiction Support Program. So we have a lovely colleague, Lloyd Main, who works with community members who are wishing to engage in cessation with all types of addictions, with the two most common being smoking and alcohol use. The program uses a holistic culture-based approach, offering one-to-one support, working to look at the person as a whole and the addiction as a symptom. 60% of the community members who were enrolled in the program have reached their goal of harm reduction. Lloyd is absolutely amazing, and really every time he speaks about what his work looks like, you can hear the care and the love shine through. He's really dedicated to uplifting each individual he supports, and I think it's rare that, especially in most of the programs that we're running, to have the level of one-to-one care that he provides. So anyone who gets to work with Lloyd is incredibly lucky. And yeah, and I just downloaded this app actually today to check it out. But we have our Métis Lifeguard app. So the Ministry of Mental Health and Harm Reduction worked closely with the Lifeguard Digital Health to adapt the Lifeguard app to resonate exclusively with the Métis community, the first Indigenous nation in Canada to do so. So on the Lifeguard app, it's an app that folks can use that comes in handy when individuals are using alone, and you can hit a timer for when you start using, and then hit a timer for when you are done, so that if you do end up overdosing and are unresponsive, the timer goes off and your location is shared with first responders. Within the app itself, when you log in for the first time, you can choose between the regular Lifeguard app and the Métis Lifeguard app. And so the MNBC version shares different resources and has different links that can help connect you to the Ministry of Mental Health and Harm Reduction. It can help connect you to citizenship in case you're wanting to start exploring citizenship more. And we're talking about how we can add more of our programming into that app, so that when folks are using it, they can see that we have peer support, we have the navigators, we have all of those things. So it is a really great app that provides instant access to the Métis Crisis Line's resources for mental health and addiction treatments, and like I said, direct links that can help prevent drug-related deaths.
Hey, Kelsey, I'm just going to jump in on the Métis Lifeguard app.
Mhm.
One of the other really awesome kind of functionality of it, and where we've tried to get our communities to sign on to try and, you know, destigmatize, is the fact that if, say, you're on your way walking to the park and you find someone down, it's a couple clicks and you're able to do your Narcan, you're able to do your CPR, you're able to do your rescue breathing and know that help's coming for you. I don't know who's been out there, but it's really hard to try and do CPR and talk to 911 at the same time. So that's just another aspect for the Lifeguard app that can be really helpful for that. As a first responder, and you necessarily don't necessarily need to utilize drugs to be able to have that resource and to be able to look at it. So I just recommend, if you have babies, sometimes they'll unlock the phone and call 911 by accident.
Thank you so much, Kate. So moving right along, our mental health team within our ministry carries the Quechua-Hatoyak portfolio. So the Quechua-Hatoyak portfolio is a comprehensive Métis mental wellness community capacity building implementation project. And I think this program and project is so important because, as I mentioned earlier on, when I was kind of listing some of these statistics that we've been able to pull from different reports, there's quite a bit in there about suicide and self-harm. And this program is building capacity within our communities to combat that. So in partnership with LivingWorks, MNBC's Ministry of Mental Health and Harm Reduction is working to expand community-based training and mental health promotion programming through implementing a province-wide implementation of 3 suicide prevention courses. So that's START, Safe Talk, and Assist for Métis individuals and communities across BC. Through this partnership, MNBC's team and LivingWorks are working to develop a Métis adaptation of the Safe Talk course. So they're taking the Safe Talk course, which is amazing and beautiful in itself, and they are infusing it with Métis culture and Métis ways of knowing and being, so that it is culturally safe for Métis people across well, for any Métis person who wants to access it. So this will be a permanent resource for future deliveries of Safe Talk courses, which I think is really, really amazing. And we have started rolling these out already. And I think the team has already facilitated quite a few Safe Talks, and I've heard nothing but fantastic things about it. And I think the Safe Talk in itself, the START, Safe Talk, and Assist are quite heavy courses at times, and it can be a lot. And I think, you know, knowing the statistics and the data that we know, our Métis communities are impacted by self-harm and suicide. So I know when I was going through the trainings last year, it was quite heavy, and knowing now that our community members are able to access these trainings, and those trainings are infused with culture and that wraparound care and support that we as Métis people bring to everything we do, I think is really, really special. And my heart feels good knowing that our community members can access this really important training, but still be culturally safe in doing so. We also have our Umalamachin, so here's medicine, life promotion for Métis youth. I believe we're just wrapping this up now, but the Ministry of Mental Health and Harm Reduction has been working to create a series of free online modules that focus on life promotion as a means of suicide prevention for Métis youth. These modules are all focused on connection. So connection to wellness, connection to culture, connection to community, connection to self, connection to land and nature. I'm really excited for when we do roll these out. And again, I know we're just wrapping up. They're just wrapping up the kind of final touches on the modules themselves. But I think something that is is really key to who we are as Métis people and Métis community, is that sense of connection. And I think that that by fostering that, by encouraging that connection to all of these different aspects of self, I think we'll have it'll be a really great learning tool for our youth in community. Something that we have just started up is our Métis peer group for those who have lost a loved one to suicide. The Ministry of Mental Health and Harm Reduction is working to create a culturally grounded peer group for Métis community members who have lost loved ones to suicide, as facilitated by a Métis clinical counselor and supported by a Métis elder. This peer group would bring together Métis individuals who have experienced suicide loss, and the group will be grounded in Métis ways of knowing, providing opportunity for community connection and support. Participants will have the opportunity to connect with a Métis clinical counselor, a Métis elder, and others who experience suicide loss through this group. Participants will also be provided with cultural care packages and resources. Through this work, we further invite space for an elder-led ceremony to honor and recognize the lives lost by suicide. We have our resilient roots. As I'm going through this, I'm really realizing, holy, we do a lot within our ministry. But so we have our Resilient Roots, Métis Mental Health and Wellness magazine. This magazine came from back in 2019. There was a committee that was started, the Métis Youth Mental Health and Wellness Committee, and through that committee of youth from across BC, they created this this magazine that's shared out, and I believe we're just in the process of editing volume 4, maybe. But the magazine shares stories from citizens, from community members that are all about mental health and wellness and substance use and harm reduction. And stories are shared through all different modes. So there's poetry, there's like story writing, there's personal stories shared, artwork is shared, and it's just this really beautiful resource that community can turn to I think it helps foster that sense of community, and it also helps foster that sense of, you know, I am not alone. There are people who understand what I'm going through, who know what might be happening for me in this time and place. So as shared by the fantastic minister, Kate Elliott, this magazine hopes to be a testament to the shining strength and resilience of the Métis community. Every part of this magazine, from the stories to the art to the poetry, comes from the powerful voices of our Métis contributors. To our readers, we hope that what you find within these pages will bring you inspiration, connection, and act as a reminder of the deep resilience that lives within us all. Again, this is one of those things that, like, if this piques your interest at all, please reach out, and we would love to send some of these your way, because they are truly fantastic. Another big project that our ministry took on over the last year was hosting 2 Métis mental health and wellness gatherings. We hosted the first one in April and the second one in October. I had the honor of being at the first one, and it was absolutely amazing and beautiful to see so many Métis individuals. I believe it was just over 100 Métis individuals, all in one space, all there to gather and talk about mental health and wellness. And it really did feel, I think the beautiful thing about Métis people in our communities is that when you gather, you may not know anyone, but everyone feels like family. And so these gatherings sought to share knowledge and teachings around mental health and wellness, and it was all grounded in Métis ways of knowing and being. A quote that has been pulled from one of the testimonials is that, you know, I love the togetherness. I feel the connections were deep within all of us without even knowing it. So yeah, it's just, I want to say it was 3 days of just jam-packed sessions and workshops on cultural wellness, on mental health and wellness. There were beading workshops, and I believe there was jigging at one of them, and we had 2S LGBTQI+ specific workshops. We had workshops led by elders and knowledge keepers, and just a really beautiful experience. And at this gathering, we had the opportunity to sash everyone with our mental health and harm reduction sash as well. And yeah, it was just beautiful. So we had the 2 last year. They have been put on hold. It is quite an undertaking to throw these kind of events, especially because no one on our team is actually an event planner. None of us come to this work with that background. So it is a very big undertaking, and we put them on hold for now, just because we have a lot, as I'm sure you all are probably getting to the point of like, oh my gosh, this woman does not stop talking. But we have a lot going on within our ministry, and there's so many things that we as a team need to focus on. But this is definitely something that we want to re-explore when everyone has the capacity to do so. So a few other gatherings that we are working on rolling out are, we have our Métis girls and gender diverse gathering that we're working on developing, and we also have our harm reduction gatherings. These 2 gatherings will be funded using funds received from the Provincial Ministry of Mental Health and Addictions, and will continue to support Métis-led mental wellness gatherings. Our Métis Girls and Gender Diverse gathering will engage elder-led teachings around mental wellness, Métis ways of knowing, relationships, culture, and identity. And I believe we are hoping to host these gatherings with young girls and gender diverse people in the kind of middle school range, I think is where we're hoping right now. And then the harm reduction gatherings is something we're hoping to roll out. And a really big piece of these gatherings is we want to hear from community about what Métis harm reduction looks like. As we've heard through our SUOP program, there's a lot about self-determination and connection to community and connection to that self-identity piece. But I think something I'm really just always in awe of our ministry is we really try to ensure that everything we do, everything we put out, everything we develop is led by community. I think we have a saying that's for Métis, by Métis, of Métis, and I think that's something that these gatherings, these harm reduction gatherings, will really showcase, is that need for community voice and input, because community is going to know what's best for community. So those are some things that we're currently working on and hoping to roll out. I believe this fall, I think, is when we'll roll those out. Our mental health and harm reduction sash is a sash that was developed by the participants of the Métis Nation BC's Alcohol and Community Health Dialogue sessions. The sash was created and each color was chosen for a very specific reason. So the red represents alcohol and addiction awareness, purple represents overdose and opioid awareness, green represents mental illness awareness, and teal represents recovery awareness, yellow represents suicide prevention awareness, and white represents connection to Earth and Creator. So as I mentioned when I was talking about those big gatherings that we host, we had the opportunity to sash each of the attendees with one of these harm reduction sashes, which was quite beautiful. And you'll often see, if you're ever at an event where there are folks from our ministry, you'll often see us sporting this sash. Yeah, it's gorgeous. I love it. We have released, or we're working on releasing the Métis Perspective of Cannabis Use, a community-based research study. It is done. It is printed. We're just working on how we want to best release it to our community. But this was a community-driven research project, and it was done to better understand Métis perspectives of cannabis use, as well as barriers that exist to using cannabis for therapeutic reasons. Once again, if this is something that kind of piques your interest, please reach out, as we are ready, I think, to share it and get it out into the world. There's some really beautiful I think there's some really beautiful learning opportunities within this research study, and a lot of it is grounded in, I think, in storytelling and connection to identity and connection to Métis identity. So really a brilliant piece of work that our ministry has put out as well. One of the big focuses for our team this year is Naomi's story. So in October 2022, a young Métis woman lost her life after seeking substance use recovery treatment and experiencing culturally unsafe care. Naomi was a vibrant, beautiful, fierce protector. In seeking to honor Naomi's legacy and to ensure this tragic pattern of loss no longer continues, our Ministry of Mental Health and Harm Reduction is working to create Naomi's story, which will be a community-led report detailing the need for Métis-led substance use and recovery services. We're really talking right now about opening some community dialogue sessions within our harm reduction gatherings to talk about like the community need for that Métis-led distinctions-based substance use and recovery services. So I'm really excited to get those conversations going with community. This is definitely work that needs to be done, and I'm so grateful that we have the capacity now as a team to start focusing on that. Métis Nation British Columbia has consistently called for action to improve substance use services in BC for Métis. The continued loss of life due to lack of culturally safe wellness services has a devastating effect for Métis communities. We must remember that these losses are not just members, not just statistics. A few weeks ago, I was in Ottawa at the MNC Health Policy Forum, and one of the presenters framed data as, you know, their data sets are not numbers, they're our family and they're our stories. So I think that's a really great way to reframe data when we do get it. It's an honoring legacies like Naomi's that we anchor all of our work. While MNBC's Ministry of Mental Health and Harm Reduction is working tirelessly to create Métis-led mental health and harm reduction services and resources, the devastating fact remains that Métis are disproportionately impacted by mental health and substance use concerns. And with that, that is our presentation. So Marcy, Jillian Jones, the email there is, Jillian's our fantastic director, who unfortunately was not able to be here to deliver this presentation. I'm sure a lot smoother than I have, but please feel free to reach out to Jillian with any questions. And again, if you're looking for the Kutcha Hatoyak book or the Cannabis Reporter or Resilient Roots or any of those resources too, definitely reach out. And with that, I am done the presentation. So I think we have time for questions, if there are any.
Thank you so much, Kelsey. That was a fantastic overview of everything that you guys are doing. There's a lot going on, which is amazing to see, all of the hard work. And yeah, we'd just like to invite everybody to either raise your hand if you have a question or pop your question in the chat. We'll give everyone a couple seconds just to kind of think about that.
Awesome. Thank you so much, Kelsey. And I just love your passion, and I could listen to you all day. Thank you so much for standing in. I think there's a lot to digest in that presentation, and a lot of different programs and initiatives, but we know we need to be doing so much more, especially in the context of the toxic drug supply. I think one thing I want to highlight is a little bit around kind of like Naomi's story, and how Métis is separate and is funded differently when it comes to access to treatment and recovery beds. Métis citizens aren't qualified for non-insured health benefits or benefits through FNHA. So quite often, people identify as Indigenous, and it's so important to connect with culture, with community, and that could be such a powerful lifeline. But sometimes it can be really tricky navigating what services, what's the best way to do without causing harm when someone's already so vulnerable. So if you have any patients who are looking for treatment options, reach out to us at MNBC. We can help navigate, kind of explore the different situations in different areas for it. There can be that assumption that there's Indigenous available treatment beds. And to have someone be ready, we've lined up the TB test, all the different things, and then to say, well, actually, no, you don't qualify, can be really devastating. And that's some of the background that we saw with Naomi and her story. A few other kind of quick things. We're working on getting some of the epidemiological study and working with the Office of the Public Health Officer. As Métis people, especially out in BC, we've done a really good job of hiding and trying to blend into the background and to not get noticed. So as Kelsey mentioned earlier, the application of self-identifying, going through, having your genealogy, getting your card. I went to school for, gosh knows like how long, like 20 years. I could barely fill out the paperwork for my kids' application. And all I needed to do was prove they were related to me. So, there's a lot of different barriers there where we know from talking to our communities, talking to our service providers, that we are overrepresented, but there is nuance and a lot of difficulty being able to give government the statistics that are able to give us some of the funding behind it. That being said, we're starting to have some of that really powerful health data that Kelsey shared, looking at some of our youth regarding self-harm, suicide, and all the different pieces. Come on, questions. Just one. Someone be brave.
Kate, I have one, and this may sound really dumb, but why aren't Métis people covered under an AHB?
It's a very long technical question. So part of it, Métis people fall under kind of this jurisdictional vacuum of the feds say they're not responsible for our health. The provinces are, and the province says, well, they're Indigenous, they're under Section 35, they're not our fault or our responsibility. So there's this jurisdictional vacuum. So we do see some health benefit coverage similar to NHIB or First Nations and Inuit non-insured health benefits on Métis settlements in Alberta and in Northwest Territories. But for the large portion, even though we are acknowledged as one of the 3 Indigenous groups in Canada, we don't have entitled to those health benefits.
Thank you. Gracie, go ahead.
Yeah, I was just wondering, wow, I really appreciated all the work that has been shared tonight. I'm just so grateful here to witness and kind of create more space and awareness on all this work that's happening. My question's connected to the Métis peer group and how the elders are supporting this work. Do you have this kind of centralized in various areas throughout BC, or is it more locally, like in one region?
That's for you, Kelsey, your SUAP program.
So if I'm correct in thinking, you're referring to our substance use and addictions program, our peer support program. So as of right now, we are operating in the downtown east side of Vancouver and Surrey, and our goal is to incorporate our knowledge keepers and Kitayak elders into the program as much as we can. Due to our very short time constraint, that hasn't looked like how we hoped it would look over the last several months, but some ways in which we've really, I think, leaned on our community and our elders is when we were developing the program. And the development of the program in itself is like a whole hour long. It takes a while to get through how we got to where we are. But when we were developing the program, we realized that there was no other Métis specific harm reduction outreach program that we could find across all of Turtle Island. That didn't exist yet. So we didn't even know what Métis specific outreach would look like and what Métis specific harm reduction would look like. So we really, during the development stages of this project, of this program, we leaned on our community, and we had some really fantastic engagement sessions with elders and knowledge keepers where we spoke a lot. We asked a lot of questions, and I got to listen and learn and just absorb so much about, what that term Kwicha we take care of each other, really means, and what that looks like in terms of harm reduction and community support. And we heard from our elders about the importance of taking care of our staff, of our peer support workers that we have working, the peer support workers that we have out on the ground doing this outreach work. So I think if I'm understanding your question correctly, and hopefully providing a good answer here, is we had our elders be really involved in the development piece of this. And then also an additional piece is in training our peer support workers, we realized that there is no Métis specific peer outreach training that exists. There's lots of great, I know BC-CDC has a great Peer Connect training program that has, its Indigenous section, but within its Indigenous section, Métis are kind of glossed over, and we really wanted to ensure that anyone who comes into this program to work in this program has an opportunity to learn about what Métis ways of knowing and being are in terms of harm reduction and outreach work. And so our elders have played a large role in providing information and knowledge and wisdom that has helped shape the development of that training, those training modules, as well as just, knowledge and wisdom that has shaped how we operate on a day-to-day basis and how we take care of our peers and those we support, the peers that we support. So I don't know if I just completely missed your question, but yeah, it's beautiful. It's been really amazing. And our elders have really enjoyed being able to participate in the program as much as they have. And I think moving forwards, when we get more funding to expand into other regions across the province, our hope is that our elders have a much more central role in the program itself and in the work that our peers do.
Super. Thank you for sharing. I often share, we need to hear more and more of these great success stories of all of these programs. So how do we do that, in all the work that we do and all the places that we go, so we could create more space and opportunities for more people, not only to self-identify, but just to become aware of this program that exists and it's within our territory. Thank you.
Did anyone else have any questions for any of our panel members?
We have LeMay Henderson raised her hand.
Oh, great. Sorry, missed that.
Hi. Yeah, of course I can think of scenarios from a not very educated point of view, how I wonder if you folks can give some examples. Like, I can imagine there are innumerable ways, the specific ways in which, besides the obvious funding one of kind of falling between the cracks in funding, how, maybe some examples of how the Métis situation does not get appreciated, the unique aspects, the unique stressors and pressures on the Métis folks in terms of versus the sort of First Nations or the Inuit people. That might be helpful to kind of get some ideas of how that really shows up in a specific way, besides the obvious funding one and getting kind of glossed over. I'm shedding some light on that.
Super. Thank you so much for that. I'll maybe take a stab. I think the funding does come into question quite a bit regarding resources, access to, addiction, mental health services that are provided by First Nations Health Authority. They're amazing, but it's kind of creating more of a gap. The context of the lived experience of Métis in British Columbia is very different compared to some of our prairie provinces. So, for example, I did my medical training in Saskatchewan, and everything was First Nations and Métis, where we're 1/3 of the Indigenous population within BC, and we're very much hiding in plain sight. A lot of people still don't know the difference, and within that, as Kelsey described, it's actually the government has painted us a very complex picture of what box we have to tick, who were we related to, and all these different things, but yet it's such a fundamental piece of our identity. It can be really hard to have to answer, like, for patients to have to answer questions or to do the teaching, because it's not clear.
Right.
And quite often you're put in the situation where you're answering questions, but then all of a sudden having to defend all 300,000 Indigenous people within British Columbia. So I think that's one of the biggest pieces, is just even having that basic understanding of that, we are distinct, we have our own languages, we have our own cultures, and we can all look very different as well. Can really go a long way. Quite often, even, if a patient discloses they are Métis, you can say, oh, where's your home community from? What are your family names? And that just provides a little bit more of that connection, and understanding. We're going into a shift right now within the ministry, as well as the health authorities, around our self-identification of Indigenous identity. They asked us when we did our college registration, all these different things, and it can be quite a vulnerable, scary place to be, because you don't know why people are collecting that information and what they're going to do with it. I am sorry, I have little babies screaming in the background. But I think there's a very complex social aspect to the Métis identity within British Columbia, where it's very different than what it is in the prairies. That probably didn't make sense. I'm going around in circles there, but I think it speaks to some of the intersectionality. And quite often, a lot of our families came out to BC and made their way west to avoid residential school, avoid different things. So there's a lot of that internalized shame, which feeds the mental health and substance use as well. So that identity piece is just so critical. But if we can tie those lifelines back to culture and community, it can just be really transformational.
Thanks,
Thank
Kate.
you.
Oh, sorry, LeMay.
Go ahead.
I was just going to move on to a follow-up question. So if you have more to add, please feel free.
No, I think that was very helpful. I'm just interested to hear more about, clearly this is a unique, unique community, unique culture. And, I imagine it's just so complex. So the more I can hear about it, the more helpful it will be. Thank you.
Carrie, I might just jump in and say, what is counted is funded. And so with the First Nations client file, for people that have status from the federal government, First Nation status, like my husband, they know his health information, and it's done all behind the scenes so that funding goes to serve First Nations people, First Nations Health Authority, because they can see what's happening with that community. With us, we had to go about it in a different way because we don't have a federal registry. We have provincial registries. So even though we have a federal definition, each province holds their own registry. So we worked with the province of BC, created an information sharing agreement, and we've shared those that want to consent and share their health information with the province. We're at about 93% consent rate, which is fabulous. We're very excited about that. And we're actually going to branch into the social determinants of health. So we have health information that is given to us from the Ministry of Health through our shared agreement through the OPHO, the Office of the Provincial Health Officer. So that report, which I know we shared last time in the link, and maybe Carrie, you can share it again, Tanche Kia, was our first baseline report, and it was a commitment of 10 years of working with the OPHO on really setting some indicators for better health and wellness. So once we have information, we can actually set goals and targets. The challenge is because it's provincial, it doesn't go down to those health authorities. So we don't have epidemiologists on staff to bring more regional or local approaches and saying, you know, for example, this is a huge concern in your health authority. How are you going to work with us to change programs and services to be more suitable or perhaps Métis specific, depending on the particular illness or issue in that localized area or regional health authority. So information, obviously, with lack of information is lack of funding. And that's kind of this role we're in. We're just spinning, trying to gather more health information, more understanding of people's behaviors and experiences in healthcare and how people can come to healthcare earlier to change their outcomes. And certainly that is one of the things that we know we need in this province. And we're excited to have that relationship with the OPHO because with more health information, we can make better decisions.
Thank you all. Margaret, you've had your hand up a while ago. Oh, it's up again. Go ahead, Margaret.
And please call me Leslie. Apologies, I'm not turning my video on because just before I decided I wanted to ask a question, I put my my Lululemon and took my work clothes off as we were doing as I was listening. So I'm not fit for company, but I'm a family physician in BC, and this may be a dumb question, and it goes back to what you were talking. I'm sort of 10 or 15 minutes back, but what I don't understand is if you are identifying as Métis and it's a provincial registry, what is there any work underway? It seems like you should be able to get the same funding as other Indigenous peoples that have status and health coverage and services. Is there any thought that that's going to happen, or I don't understand why it wouldn't? I guess I'm confused by that.
Leslie, if you could write that to Minister Eby and Prime Minister Justin Trudeau, we would love to hear their answer. And being a little cheeky there, I think that's one of the things with MNBC and the leadership is that recognition of our rights as Indigenous people. There's UNDA, there's UNDRIP, there's all these different things, but there's that why would we take responsibility for you if our hands haven't been forced to it, right? So it's part of that reconciliation and being at the table and being able to work for our rights, because it has been a fight.
Well, and one last question along that line is, if you identify as Métis and go through all the work, and it sounds like it's a lot of work and forms to, identify yourself as related through your ancestry, even through your mother, father, family. I guess, sorry, my thought kind of got stymied there, but if you've gone through that work and you've done that, are you actually opting out of being recognized as being eligible for being an Indigenous peoples with status rights?
Yeah. And
are
so
you
quite-
choosing to
quite-
like, are you choosing
So-
to identify as Métis and giving up those rights? Like, that just doesn't seem fair.
a lot of us have family members that would
Mhm.
qualify for status
Okay.
or Métis, and really it comes down to that distinct culture of how we're raised and how we're identified, right? Like blood quantum. I think there's like 2 Chihuahuas down the hall that if we swab them, Ancestry would probably say they're Métis. It's about our values and how we're connected as a people, our language, our stories, like our teachings from our Mosham, our Kukum, our ancestors, right? So there's definitely this huge cultural side, and part of it, the government shouldn't be able to tell us who we are, but unfortunately that's the part of the legacy of colonization, is that we have to play by those rules. And quite often we have community citizens who are proud Métis, but sometimes that, oh crap, I really need access to dental care or some of my medications, where it can force people to choose, which I don't think anyone should have the right, but it's part of that complex Indigenous identity.
Well, I didn't realize that that was an issue before tonight.
Mhm.
So that's something that really kind of upsets me in terms of, and I'm, not Métis or Indigenous, but I come from Scotland, and it would be that's not relevant. I don't want to say anything that's not appropriate, but giving up my heritage in order to get the rights that you should have just seems wrong. And your specific heritage, there should be some kind of a support from the medical community to say, you should have the same rights and support and privileges, especially with healthcare. So just, you have my support anyway, but I'm shocked that you don't have the government support.
Amazing. Thank you, Leslie. And I think some of these complex nuances of identity, like no one's expecting every family physician to be able to engage in some of these conversations, but you can see I've been in this space for, advocating the last like 15 years. And sometimes these questions are hard, but if it's done in a confrontational manner, or oh, well, you can't answer my questions, it can be really hard for our patients. And can really shatter that identity piece. And to be quite honest, I've had experiences. I sat as one of the co-chairs for the In Plain Sight task team that just finished up over the last 6 months. And I've had really negative experiences with healthcare when that question of indigeneity is asked.
Wow.
Being asked of, well, are you Indigenous? Yes. Oh, well, can you point to which one you are, and have the provider turn a screen towards me and ask me to point to, like they're testing me to see if I could read. They asked me if I lived on reserve, and fair enough, that's a skill testing question. I said, no, I don't. And they're like, well, what ethnicity does that make you? And I'm like, I'm not a border collie. Oh my goodness. But in the interaction, they knew I was part of the physician community in town. And then, so some of the documentations and even, having this persona or this armor of like, I got so many letters behind my name, I got this, there's still that othering, and that you don't belong, and that you're not good enough, really embedded into our system. So I think
So wrong.
being open and honest and asking, having a bit of that humility can be really powerful. And most of our community members are really open to having some of the conversation and discussing. It's just about doing it in the right way.
Safe, in a culturally safe manner.
Yeah. I'm also a little bare about the interaction I was talking about, because I I take an ADHD medication. I got listed as I have a perinatal addictions issue, and that subsequently during my complex pregnancy came back to haunt me. But you know, I think there are so many good people in our system, but it's those experiences. You can tell how raw that one is for me. It takes a lot of really positive ones to negate some of the bad ones and to reestablish the trust. You know, quite often we say it takes years, sometimes decades, to form good relationships, but they can be burnt to the ground so quickly. And it's no different with our patients. And just knowing, especially with mental health and substance use, how that trauma is just so alive, and that fight or flight is so strong as a result. I'm rambling. I acknowledge we're
Yeah,
time.
sorry,
So
Kate, I was waiting for a natural pause.
I can talk forever. It's like my superpower.
And you know, I think some of us would like to hear you talk forever as well. I did have one very quick question just before we wrap up. And I also wanted to draw everyone's attention to the chat where Britt is putting some links to sessional form for physicians who are in attendance. But the magazine that you guys mentioned earlier, Resilient Roots, is that available for people to order for their practices? Tanya, this might be a question for you.
Hi, thank you. So certainly we do, I believe, have some older copies of Resilient Roots. As far as our printing and distribution, obviously that is dependent on funding, and we are waiting for bridge funding from Indigenous Services Canada for mental wellness programming. So I would say right now our copy of Resilient Roots #4, I think you are correct, Kelsey. It will be #4 because I'm remembering the covers, will be available online, definitely to download, and we will look towards doing some printing in the future. But I do believe we have copies of previous editions that we would be able to share.
Great.
And I do want to quickly acknowledge the question from Gracie in the chat around the Fraser Salish Partnership Accord that was just signed February 2nd, and the significance of that and the relationship. So normally in British Columbia, you know, the partnership accords are signed with First Nations leadership and the Health Authority. Because of the great work from In Plain Sight, I would say, and the work of Louis DeJagger, our Minister of Health, and his relationships with the Fraser Salish leadership, 32 of the Fraser Salish leaders and Métis Nation BC agreed that Métis Nation would be a equal decision-making body at the Indigenous Health Collaborative Council, which is a new body that's being built. So it's very exciting for Métis Nation BC, and really wonderful to see Fraser Salish leadership really recognizing us as an Indigenous body and governing our people within Fraser Health Authority, because we have over 8,000 citizens within Fraser Health Authority. So really excited for that work ahead of us. And it's also new. The pen, you know, the ink has officially dried, but to see, you know, Minister Adrian Dix there, and the beautiful ceremony that happened out on Shui Village was really amazing. So was super happy to be a part of that and excited for the future and what that may look like within Fraser Health Authority and the funding and decision making that comes from that for Indigenous people.
Thanks, Tanya. And Kelsey just popped in the chat as well that the Mental Health Navigators have developed a Métis cultural safety and awareness package that can be sent out to practitioners. And if you are interested in receiving one, you can email, there's an email address there. We will include that in our email that we are also going to send you all sometime tomorrow with the webinar recording and some other resources that are available. And April, I see your comment here as well. Tanya, she's just asking if you're able to share some links with us as well about what you just mentioned. So feel free to email that to me if you'd like me to include it in the wrap up email. We're also going to have Margaret. Yeah, thanks, Britt. We're also going, I just wanted to draw your attention as well in that email that we're going to send you. There's also going to be a survey. If you could please just take a moment to fill that out, that would really help guide our work. And yeah, I'm just gonna, I think, pass it back to Gracie to close us off tonight.
It's been a wonderful evening of learning from all the wonderful presenters here. Thank you for committing your time to be part of this very important work. I look forward to continually learning and developing more awareness. And I want to acknowledge everybody tonight and safe journey on wherever you need to go for this evening. And have a good night, everybody. Thank you.